Kalimera. I think I've been 5 years now in Greece. I can say Kalimera with strong emphasis. Let me introduce myself and all my esteemed colleagues at this panel. I hope that this will be a fantastic session, I'm sure. It is then my great pleasure and honor to welcome you to this first session. Will be the first session after the opening session, and it's called Global and EU Perspectives on Tackling Childhood Obesity. I would especially like to extend a warm greeting to the honorable ministers, the representatives from the Ministry of Health, in particular the alternate Minister of Health, Dr. Agapidaki, and congratulate them. I have seen with my own eyes the work carried out in these last years, and it is outstanding. So congratulate you all. Obviously, this includes the valued partners from UNICEF, as well as all distinguished guests, and a special reference to our Honourable Minister of Portugal here today, Dra. Ana Paula Martins. So joining me today in this session is Dr. João Breda, head of the WHO Athens Quality of Care and Patient Safety Office, officer in charge and special representative of WHO Greece, Dr. Eliza Markidou, senior clinical dietitian, head of the nutrition department at SHS, Cyprus, please correct me if I did it wrong, Ms. Eugena Tomini, Deputy Minister of Health of Albania, Dr. Cristina Tamazlîcar, Senior Consultant, Maternal and Child Health Service, Ministry of Health of the Republic of Moldova, and Ilano Almeida Barretti Silva, Deputy Secretary for Primary Health Care in Brazil. So thank you all for your presence. I will obviously give the floor now to Dr. João Breda for his initial remarks. Thank you.
Kalimera σας. Good morning, everyone. It's a pleasure to be here. First and foremost, I would like to commend the Ministry of Health of Greece for hosting this important meeting today, celebrating achievements, but also for all the process of putting together, setting up this very important action plan, of course, under the great leadership of alternate Minister Agapidaki. I would like to commend you for that. I would also like to recognize the great leadership of UNICEF in Greece and my dear colleague, Dr. Ghazan Khalil. It's a pleasure, really a true pleasure to work with you. And I would like to really express my full commitment to continue this collaboration and to say that we are actually an example of WHO and UNICEF working together in European countries. And that is thanks to you. So congratulations, and thank you very much for you and your team for all the great work. Also all the partners, I see so many academic institutions across the globe, but allow me a special reference to the ones in Greece. You have a great academia, great experts, great scientists. You look at their academic profile and it's really impressive. So a lot of work done in Greece by academia generating evidence, but this evidence is now being put into practice. Also is commendable the fact that actually Greece took the European funds and the resources that were made available to work and to focus a lot on prevention. Not just on childhood obesity, but we see the screening program, which is a huge success and really something to be followed by others, as also investing in collaborating in WHO in the very sound and profound reform of primary health care, the integration with public health. I see here the Honorable Secretary General of Public Health. So thank you very much for your great support and this collaboration. But allow me a special reference to the Honorable Minister, of course, of Portugal, my own country, which I'm always very proud of the work that has been done in the last 10 to 20 years in the field of childhood obesity. All this success is increasing and accelerating under the leadership of Professor Ana Paula Martins, no doubt about that, but all started more than 20 years ago, around 20 years ago, actually not far from here in Constantinople, in Istanbul, where we had the first European conference on obesity at the time. And also the Portuguese Minister of Health at the time he was there, and he told us all, Colleagues, next Monday, I want you all in my office because we're going to start a new project on childhood obesity. And here's where we are. 20 years after, Portugal is one of the countries where obesity actually has decreased the most, and there looks to be a very stable situation at the moment, but that took a lot of effort and action. So we know there's a lot of pressure in terms of public health, and childhood obesity still is one of the most challenges in terms of public health in Europe and globally. It has serious consequences. Everyone talked about it, but here we know that 1 to 3, to 1 to 4, probably in Greece, is 1 to 3 kids, 6 to 9-year-old, they live with overweight and obesity. This is a very serious health condition. I think there's no other like that in infancy and childhood, and we really need to acknowledge that. The one that comes closer is maybe mental health. And imagine what? The bad news is that mental health is also strongly connected with overweight and obesity in children. So we really need to look at this and address it together. So we know the increase of risks on cardiovascular diseases, on cancer. We identified connection with at least 8 cancers from obesity. We've done that together not long ago with IARC, also the other WHO agency. But really, I would like to underline the connection with mental health, which my colleagues and colleagues here in the room will talk about that today, but it's really very serious consequences on top of the health inequalities. The problem is that Southern European countries, Portugal, Spain, Cyprus, Greece, we live with the highest prevalence of overweight and obesity. And there are reasons for that maybe they are not entirely known, but we know some of the reasons. And there's also a lot of action in some of the countries where more action is being taken forward, but we are special. We are special in the challenge. This is why it's so important to act together. We can't just copy-paste what others do. We have the potential to lead. And here we've seen 2 countries that are leading the way, both Greece and Portugal, in different ways, but leading the way in tackling chronic non-communicable diseases with a focus on childhood obesity. With all the due respect, this is not the point where we look to our beautiful friends in the north of Europe and Scandinavia. Here we are acknowledging the evidence and we are taking action because we acknowledge how big the problem is. The European region of WHO started the process in 2007, 19 years ago, the biggest childhood obesity surveillance initiative in the planet. Together, we measured already more than 1 million kids in more than 40 countries. This is unique leadership from the WHO European region. You have comparable data, several rounds, 5 or 6 rounds already, right? 6 this in preparation. It's amazing. A huge amount of scientific evidence that's been produced, but more important than that, what gets measured gets done, hopefully. And with this data, countries have managed to come together, to organize themselves together, and the European region leadership with Greece also in the driving seat, because Greece has joined, I remember well the day when Greece joined on the second round the Childhood Obesity Surveillance Initiative, which is something unique and it's very important. So we still have to acknowledge that we are in countries that still live with one of the highest prevalence. And that means overweight and obesity, but it also means that maybe close to 1 in every 10 children live with a very serious condition related with obesity. Severe obesity if you want. This is a situation that has much more serious health consequences. So it's not just the overweight, it's not just the obesity, it's the one that is really serious and already brings consequences at the level of skeleton, mental health, insulin resistance, high blood pressure, and all those things that we know. And those are also related with inequalities, and of course, we know that poverty and lower levels of education here play a very strong role. They play a very strong role in the south of Europe. So it was said before, we need coordinated action, all of government approach. We've seen here that no single action can result on success around childhood obesity. We know it. You need to work with different stakeholders, from the food industry to academia to the Ministry of Education. Of course, the Ministry of Health needs to lead and needs to lead by example. I cannot talk about childhood obesity if I don't have a system at primary care level to deal with the families that have to live with overweight and obesity. This is what Portugal has done, and this is what I'm also proud to say that we are also discussing and working together here in Greece. So it's very important that we take that, that we acknowledge that, and that we look at this intersectoral action with decisive intentions and really do what needs to be done. Also, the difficult ones, working around food reformulation, using taxation, making changes around opportunities for physical activity. I remember that Greece is also one of the countries that has increased the number of hours of physical activity in schools, as Portugal has done also years ago. So it's really important that we take these two together. We should not forget the importance of physical activity and the promotion of physical activity is as important as food and nutrition. Sometimes physical activity is like the black swan of addressing non-communicable diseases. It shouldn't be. And I'm very proud of the action we took years ago in the WHO region when I was leading the nutrition and physical activity program. We were the first WHO region to have a European strategy to address physical activity. 53 countries together. You remember that, Eliza? Yes. And that was important because then global level followed through, and now we have global tools on this area. But it's really important that we can highlight successes, but we also acknowledge the challenges. So I think that altogether we can and we will continue to ensure that we implement these comprehensive policies. What I can assure you that from WHO, you can always count on us. We would always be there either to lead, to support UNICEF leading, but to do it, as it was said, together. What I always like to tell my collaborators in Greece is, yes, competition is nice, but collaboration is more important. This is what we are doing here today. So thank you very much, and very much looking forward to work together again.
Kindly ask for the presentation. Thank you so much, João. This already was a very interesting presentation to do because this was a shared presentation. So instead of having each one of us, this is how we started, already with strong collaboration between us. Very nice. I would like to, let me see where I have the, okay. Okay, so this actually supports very well the words of Dr. João Breda. These are 20 years of action on tackling childhood obesity. You see on the first picture, this was the Portuguese committee in Istanbul, where the European Charter on Counteracting Obesity was launched. This was a true commitment by 53 ministers of health. This was a really, really key point for Portugal, but also for Europe. This was a turning point. And this was a turning point to address, almost not for the first time, but it was a very important moment to address obesity as a public health challenge. At that time, childhood obesity was only beginning to receive the political attention. So we needed the political will back then. And we started right there. 20 years later, we are in 2026. Obviously, most of us that have been, dealing with the obesity problem for more than 20 years know that we have to reflect at some point on the journey. This has been obviously 2 decades of research, partnerships, policy discussions, advocacy, surveillance systems, difficult conversations, and above all, a shared commitment to improving the health of the future of children. So, again, we just talked about the WHO European Childhood Obesity Surveillance Initiative. This has been, since the beginning, the great example of cross-country collaboration. This not only gives robust evidence on trends in overweight in an harmonized way, so every country that participates in COSI do it exactly the same way. We give robust evidence, but it gives a lot of support to stimulate and monitor policy action at national and European level. You can see here our WHO Collaborating Center has been very committed since the beginning to support all of these countries coming into the network. We started with 13. Portugal was already in one of the countries, Portugal and Italy, were the countries that actually were leading this network. And we have 48 countries now. It's really one of the biggest network, I would say, one of the biggest, I think, at WHO European region is one of the biggest network, and we actually measured 2 million. Dr. João Breda said 1 million, but it's actually 2 million people. Now, what we have here is, this is the data from the last round. So on the 6th round in 2022, we have this collection of data for 37 countries, and you can see that we started, let's say, in 2008 with a 27-30% of children overweight. We are now on the 25 overall. But obviously, as you can see here, the Mediterranean countries in the left end are the ones with higher prevalence of childhood obesity. It ranges from 35 to 42. Yet you can see also, and this is very important, you can see that we have been very good results in most of these countries. So when we talk about the Mediterranean, and Greece included, we are talking of really, really a great political will to address childhood obesity. Obviously, Portugal is included, but you can see Cyprus as well that has been have had good results, and this is just compared one round to the other. So I also would like to highlight this recent publication from Nature, and it says obesity rise plateaus in developed nations and accelerates in developing nations. So this is a great opportunity, because we also have Brazil here, that we can try to explain that 20 years ago we didn't talk about some of the nations regarding childhood obesity, maybe on the other hand, but today is actually a global thing, and obviously some of the countries that has the highest prevalence have been addressing it maybe a little bit on a deep lens, but we need to treat this as a global problem. Now, from the rest of the session, I will invite all my dear panelists, and each one of us will address these 2 slides regarding the prevalence in each country and also the initiatives in each country. So you can either do it from there, or you can come here, as you wish. I'll start with Portugal. As highlighted by the Honourable Minister of Health here today from Portugal, Dr. Ana Paula Martins, Portugal has been in the forefront of policy action in counteracting childhood obesity. You can see here on the first 10 years that we actually had a decrease of 8.2 percentage points in overweight. This has been a very, let's say, the first 10 years has shown a steady decrease. It seems that from 19 to 22, a slight increase or stabilization. We actually lead this publication on the impact of COVID, and we understood that obviously these were COVID times. And we have to understand now on the seventh round if this stabilizes, if it will increase, what will, in terms of the trends in Portugal, what will happen. But as you can see, a lot has been done. We have here a comprehensive approach. The words that our Honourable Minister from Portugal said in terms of political will, but also in the comprehensive approach, it's right here. We have actually involved all stakeholders, civil society, and this intersectoral collaboration actually started with the National Platform Against Obesity that was mentioned by Dr. João Breda back in 2007, here, the Platform Against Obesity. And we started with media campaigns, we started with a national program in schools, communities, and this was to enrich the society with awareness. And the society needed to understand that obesity is actually a disease. And it's something that has to be on their household to be addressed. We launched the sugar sweetened drinks tax, like Dr. Ana Paula Martins mentioned, back in 2016. It was revisited in 2018. And actually, it has shown a 36% of decrease on sales of this sugary beverage. Another important initiative that I brought here, of course, the slides would have a lot more initiatives, but we brought, I think, the main ones, was the industry agreement to reformulate sugar, salt, and trans fatty acids levels in food products, which has shown a great commitment from the sector with reduction on salt and sugar content of several products. The 2019 law on restriction on food advertising for children under 16 years old, which has been a good source of data for policy impact evaluation, guiding the attention where monitoring of marketing of foods children should be placed. And obviously, we still have a lot to do. We still have 1 out of 3 children with overweight. So it's nothing, I mean, we still have to continue the work. And I take my opportunity to say that this has to be always high in the political agenda. But we also have to mobilize, the society to co-create solutions. And I think this is the key as well. And obviously bring everybody along. So thank you so much for this presentation. Let me go give the floor to Cyprus. Do you want to speak there? Okay.
Well, hello? Okay. Well, it's a pleasure and an honor to be here with you today. And before I start, let me congratulate the Ministry of Health of Greece and the UNICEF and Dr. Agapidaki and Dr. Mr. Hassan Halil for all this initiative. It's really something that's coming true, that whatever we're thinking about obesity and childhood obesity, it came true in Greece and it took action. Well, Cyprus has one of the main public health problems that we have in Cyprus is childhood obesity. Actually, it's the greatest public health problem we have. And as we know that if we have childhood obesity, we will end up with adult obesity and all the consequences that we have with high blood pressure, NCDs, diabetes. So it's a really big problem. We joined COSI program, the Childhood Obesity Surveillance Initiative, from the very beginning. We didn't have results. We got our first results in round 4, and it was really a big surprise, a very negative big surprise, because Cyprus had the highest childhood obesity among all the countries that participated. And throughout all the cycles now, we're in round 6, we still are the champions to this negative effect of childhood obesity. We'll see that throughout our life from round 4 to round 6 that we had fluctuations, but still we remain with the highest rate of obesity that we should take care. As Ministry of Health and as society, we try to do several actions on this thing and work on this issue of childhood obesity. we focused on how we will bring together the family, the children, and the school in order to have good results. So we tried to do different actions in schools, in having exercise in school, in promoting fruits and vegetables in schools, and doing programs that will educate children, families, and the educators and the professionals that were working in schools. The latest program we had was a very successful program called Become a Health Ambassador. We tried to train children to learn what is the healthy issues of life, the lifestyle, and to be able to tell their other colleagues and spread the word around it. We deal with exercise, with sleeping, with nutrition, and we were very proud to say that it was a very successful program. But I should say and stress here that our main problem is that we don't have a strategy and we don't have a continuity in all these programs. And the main reason is usually the lack of funds. A lot of money are being put in the budget of health for treating diseases, for treating diabetes, for treating cardiovascular diseases, but very small amount are given to prevention and to help us do these programs. Last week, we were very happy to have the inauguration of the first Cyprus Association for the Study of Obesity, and we're trying to focus on these issues of obesity, but we still have a long way to go. What I see here is that all these things that for me personally was a dream and a struggle had happened to Greece. And I'm very enthusiastic that this was put into practice. I hope that being a small island near Greece, that we will be able to benefit from this. And a small note that I'm finishing, I will say about the Mediterranean diet. Our position and our country, it's a Mediterranean country, has the privilege of a Mediterranean traditional diet. We should bring it back to our children, and we should bring it back to our country in order to be able to succeed and get our health back, because we do have a problem. Thank you.
Thank you so much, Dr. Eliza. Thank you. Thank you. We'll reserve the questions at the later end of this session. I will now give the floor to Ms. Eugena Tomini, Deputy Minister of Health, Albania. The floor is yours.
Yes. Thank you, dear Anna. It's a great pleasure for me, and I'm honored in name of Ministry of Health and Social Welfare of Albania. It's a great pleasure for me because I am expert in public health, and this issue is very important for public health. Childhood obesity is today a profound and complex challenge in the WHO European regions, globally, in Balkan area, and in each country, because it's very important for us to protect health of our children. In consequence of obesity and overweight, Albania is implement the COSI project and health behavior age schools and children. In two of this project, Albania in each round expressed interest to be in these projects, and with in the last conclusion of COSI project was with the high level of obesity and overweight, and in the health behavior age schools and children was with the same parameters or high level of obesity and overweight. In the same time, in these two projects, Albanian children have among high levels of fruits and vegetables consumption in the region, an important basis for promoting health eating habits. In our priority of the Albanian government, we include promotion and prevention of obesity and overweight in some documents. In our National Strategy 2021-2030, In our program for prevention and control of non-communicable diseases for the same period, 2021-2030, in an action plan for health promotion 2022-2030. But in the same time, we include or we give our commitment in the network for prevention of childhood obesity in the WHO European country in Zagreb 3 years ago. But sometimes it's very difficult to have a good coordination and collaboration between sectors and in cross-border also. For us, it's very important to have more results in our implemented projects, for example, in nutrition education integrated into school activities program across the country. Awareness campaign for children, parents, and teachers have increased significantly. Physical activity hours in our schools in all the country have been increased from 19 minutes in 145 minutes, and sports and recreation infrastructure have been improved. Advertising and marketing on unhealthy food in the school environment has been implemented. Programs such as Schools for Health and BIBO application support family and community with information and education on the well-being and healthy nutrition of infants and children. However, significant challenges remain for the future because more intersectoral collaboration will be in place. Many political regulation will be in place in each sector for all the government and all the institutions in our country. Dear colleagues, childhood obesity is a complex, multifactorial and cross-cutting challenge. No institution or country can address it alone. For this reason, regional and international cooperation, the exchange of the best practices, and support for evidence-based policy are essential. Albania remains committed at continuing to work together with WHO, UNICEF, European Union, and our international partners to ensure for every child has the opportunity to grow up in a healthy, safe, and supportive environment. Thank you.
Thank you. Thank you so much. Thank you. We will move now to Dr. Cristina Tamazlîcar from the Ministry of Health of Republic of Moldova. Thank you so much.
Thank you. Distinguished colleagues, thank you for the opportunity to share the experience of Republic of the Moldova in strengthening maternal, infant, and child nutrition and in addressing the childhood obesity prevention. In the Republic of Moldova, the maternal, infant, and child nutrition is a part of the broader action plan for the implementation of the National Program for the Prevention and Control of Non-Communicable Diseases for 2023-2027. The actions from the plan are focused on the healthy eating promotion at all ages to ensure zero increase in obesity and diabetes rates by 2030. It includes activities aimed at promoting exclusive breastfeeding, reducing unhealthy food, marketing to children, strengthening healthy food environments in educational institutions, and developing nutritional counseling services for maternal and child health within primary care. The expected results of the implementation of this program by 2027 are aligned with the HAO European Action Plan for the Prevention of Non-Communicable Diseases for 2016-2025, global and regional nutrition targets, the Sustainable Development Goals, and the National Development Strategy European Moldova 2030. The findings of the sixth round of the HAO European Childhood Obesity Surveillance Initiative in the Republic of Moldova further underline the importance of strengthening nutrition and obesity prevention policies. According to the study, 1 in 5 first-grade pupils is overweight, including 8.8% living with obesity, while 6.5 are underweight. Although these rates remain below the European average reported across 48 participating countries, they show an increasing trend among our child, and excess weight is more frequent in boys and among children living in urban areas, while obesity is more common among children whose parents have lower educational level. The COSI findings also revealed important behavioral risk factors. Only 3.5% of children meet the HAO recommendation of eating daily 5 portions of fruits and vegetables, while 20.4% of children consume sweet snacks and sugar beverage carbonated every day. Sedentary behavior is also common, with nearly half of boys and over 40% of girls spending 2 hours in the front of the screens. In addition, parental perception of the children's weight is often inaccurate. This contributes to delayed identification and intervention. These findings emphasize the needs for comprehensive multi-sectoral measures to prevent childhood obesity and other non-communicable diseases from an earlier age. There are mandatory measures on school and food beverages that are aligned with the HAO guidelines for healthy diets in the country due to joint efforts of the Ministry of Health and the Ministry of Education from the Republic of Moldova, which resulted in adoption of the mandatory for implementation of a common order on the organization and provision of nutritional health children and students in general education institutions, and healthy foods are provided in all general educational institutions in the Republic of Moldova, with 67.5% of institutions are offering only healthy food. National legislation is continuously updated to better align with the International Code of Marketing of Breast Milk Substitutes and related Health Assembly for Resolution. In 2025, the prohibition of the distribution of the free samples of infant formula to pregnant women, mothers of infants, and young children and other members of their families by healthcare workers, and on acceptance of any financial or materials inducement from manufacturers or distributors were included in national sanitary regulation. In 2025, the Ministry of Health and UNICEF conducted a feasibility study on establishing the first human milk bank in the Republic of Moldova, and the study shows that approximately 1,800 premature babies are born in Moldova every year. And access to the donated breast milk can help reduce the risk of infections, complications, while supporting a healthy development of premature and vulnerable newborns. The report also highlights the needs to establish a national human milk bank supported by a multidisciplinary team, clear protocols for collection, processing, storage, and distribution of human milk, specialized equipment, and national referral and supply networks. In 2026, important steps have already been taken, and the Ministry of Health, with UNICEF support, is currently working to establish the first human milk bank in Moldova in the Institute of Mother and Child. In conclusion, we had made important progress in strengthening maternal, infant, and child nutrition, from improving breastfeeding indicators and healthier food environment in school to advancing policies aligned with international standards and taking concrete steps towards establishing the first human milk bank. At the same time, the data remind us that there are more needs to be done to prevent childhood obesity, to improve dietary habits, to protect breastfeeding, and ensure that every child benefits from the best possible start in his life. Moving forward, continued investments in evidence-based policies, nutrition surveillance, social behavior change and intervention, and cross-sectoral collaboration will be essential. We would also like to acknowledge the valuable support of the HAO and the UNICEF in supporting of Ministry of Health to implement the policies for children's well-being. We look forward for learning from international experiences and working closely with national and global partners to build a stronger, healthier, and more resilient future for every child in the Republic of Moldova.
Thank you so much. Thank you. Thank you. And with no further ado, I give the floor to Helena Almeida Barretti Silva, a name that I can actually pronounce. Deputy Secretary, Secretariat for Primary Health Care from the Ministry of Health of Brazil. Thank you.
Okay. Members of the panel, authorities, thanks. It's a great honor to represent Brazil and the Brazilian Ministry of Health. Childhood obesity is now one of the biggest public health challenges in the world, as you can see in Brazil also. As you can see in the graphics, and it requires organized, intersectoral, and sustainable responses. In Brazil, we have been working to improve this agenda based on fundamental principles: social protection, health promotion, and comprehensive care from the first years of life. Under the leadership of the President Luiz Inácio Lula da Silva and the Minister of Health, Alexandre Padilha, the Brazilian government has prioritized strong public policies focused on improving living conditions of Brazilian children. For this reason, Brazil created a national agenda with intersectoral governance mechanism, bringing together the federal government, national congress, states, municipalities, and civil society to expand the protection of children's health across the entire country, like indigenous region also. We'd like to highlight this agenda through two main pillars. The first is the integration on health, education, social assistance, and human development. The second is focused on improving regulatory measures to protect children from unhealthy food environments. In Brazil, through the Unified Health System, SUS, one of the largest public universal health systems in the world, we carry out essential actions to promote children's health and prevent obesity. In primary health care, family health teams monitor children's growth and development, carry out nutritional assessments, identify risk factors early, and promote health, eating, and comprehensive care. We also improved policies that encourage exclusive breastfeeding during the first 6 months of life, recognizing its important role to protecting children's health and preventing obesity throughout the life. But it's important to recognize that our biggest challenge today is unhealthy diets. Poor nutrition is already one of the main risk factors linked to the global burden of disease, and improving people's diets can prevent millions of avoidable disease around the world. With leadership of health sector, this agenda must be addressed across different sectors. Guaranteeing the human right to adequate food requires intersectoral action and coordination among different areas of the government. In this context, the Ministries of Health and Education work together to strengthen the implementation of Brazilian dietary guidelines as a reference of public policy related to health eating. As I have this, and I will deliver it to my colleagues of the panel. As a concrete example of this integration, I would like to mention the program in the school health, which promotes a joint action between primary healthcare professionals and teachers around 105,000 Brazilian schools. We also improved measures to reduce ultra-processed foods and prioritize health foods produced by family farming and the National School Feeding Program, which provides free meals for around 40 million public school students. At the same time, the Brazilian government has improved regulatory measures to protect children and adolescents from increasing exposure to ultra-processed food products. Recently, we approved a national law restricting the use of cell phones and electronic devices in schools, recognizing that excessive use of these platforms can increase exposure to digital advertising of unhealthy foods, encourage sedentary behaviors, and also affects mental health. We are also working in the national legislation to restrict the sale and the marketing of ultra-processed foods in public and private schools. In addition, we celebrate the recent advances of the Brazilian tax reform, which will increase access to health foods and align Brazil with WHO recommendations and successful international experiences. Finally, as Minister Alexandre Padilha recently highlighted in the World Health Assembly, we recognize that we will still need to move forward in the regulating the advertising of ultra-processed food products, especially in digital environments. For this reason, Brazil has been working with partner countries to strengthen the international initiatives to protect children's health in the digital environments. And now we are also moving forward to discussion on broader international agenda focused on marketing of ultra-processed foods as a measure to protect human health. We hope this discussion can continue to advance toward the next World Health Assembly in 2027. We need to build healthier food environments to protect our children and reaffirm that adequate food is a human right and an essential condition for the future of the next generation. Thank you very much.
Thank you so much. This will be just a final round of questions that we reserve for our panel. This will be just 5 minutes. I will selected 6 questions for our dear panelists, and I hope to get from you just 1 minute comment. And I will start with Dr. João Breda. I believe the question from all of them you selected was this one: is there a lack of political commitment?
Thank you. In less than 1 minute. No, I don't think so. I think that everyone realizes that childhood overweight and obesity is really becoming a serious problem, and we know the connection with future chronic diseases, and also let's say, to ensure that every children fulfills its human capital. We know now that childhood obesity is one of the most serious health conditions that we can have. And that the importance that you have to attribute to it needs to be at the level of immunization, of dealing with mental health issues. So it's a very important. But of course, we have to understand that policymakers have to make choices, and sometimes they act and take action on small cycles. I think there is a huge interest, there is commitment, but there needs to be, the scientific community sometimes doesn't speak the right language, and we kind of find it strange that we have the data and ministers don't take action. Why is that? We have to understand that cycle of decision is complicated, and that we need to identify solutions. And more important, what we are doing here today is bringing experiences from other countries, learning with the others, doing it together, collaborating. I think this is the best way to implement this political commitment, that it's there, I would say, for most European countries.
Very good. Thank you so much. For the next question, for Dr. Eliza Markidou, are low financial resources in health key barriers?
Yes.
It's not a yes
Okay.
or no.
Well, I have mentioned this when I made my introduction, that it's a key barrier. But what we'll try to do is to make the people that they take the political commitment to understand what is so much important in this childhood obesity, and then we will be able to get the financial resources. As I said, usually when they put the budget in the parliament, they have a big budget for the treatment of diseases and a very, very small budget for prevention, and especially on nutrition. So what we're struggling to do is to make everybody understand that if we make a prevention, it's like that we are investing into our future. So yes, it's a key barrier, but we have to overcome it. And I think we can overcome it by doing all these sessions and showing the importance of the thing.
Thank you so much. Thank you. It was very insightful. For Ms. Eugena Tomini, I have the question, is there a need for more coordinated action between sectors at national level?
Thank you, Anna, for this question. Yes, childhood obesity needs or require multi-sectoral coordination. I mentioned in my remarks before, and it's very important to be in one booth, all, health, agriculture, food, promotion, schools, education, community stakeholders, local government, media, because it's very important to coordinate all the steps between us to concrete our activities, because it's very important to be aware for this topic or issue in public health. And without the government alone, nothing happens. It's very important to coordinate the mechanism and to financing these topics for promotion and health promotion for all the elements and stakeholders and for all institutions in our countries. Thank you.
Thank you. Thank you. It was very insightful as well. Now we move on to Dr. Cristina Tamazlîcar for the question, is there potential for stronger cross-country networking? Basically what we did today.
Yes, we absolutely believe that there is strong potential for deeper cross-country networking and collaboration in the area of childhood nutrition and obesity. Many countries in our region are facing the same challenges, such as unhealthy food consumptions, sedentary lifestyle among children, and difficulties in achieving long-term behavioral changes. For example, Poland's experience with developing their first human milk bank served as an important foundation for the establishing of the first human milk bank in the Republic of Moldova. The Polish experts participated in the feasibility study and continue to support our national experts in the establishing of our first human bank. Also, we would like to learn from Portugal, maybe, because
and Greece now.
Yes, implemented the taxation on sugar-sweetened beverages that, as a part of your public health measures, to reduce the unhealthy consumption of these beverages, and sharing evidence of the impact of such policies, including lessons learned and challenges, can support and help other countries in adopting the approaches to their national context and to approach to their national context. Also, we believe that Moldova can contribute to sharing our experience with other countries in strengthening intersectoral collaboration between the health and educational sectors on improving the national school nutrition standards.
Very good. Was very nice. Now moving on to the almost final question. Is there potential for stronger cross-country networking? No, sorry. This was not the oops, sorry. I didn't put it there. Does the lack of healthcare professionals in public sectors delay obesity prevention? This is the question for Ilano Silva. Thank you.
Thanks for this question, because it gives the opportunity to speak a little bit more about the Brazilian health system. So currently Brazil has 55,000 family health teams. If we consider the total of the professional in Brazil, it's about 1 million, just in primary healthcare. So I believe that if I consider the Brazilian case, I think that we have enough professionals. Also, it's important to consider that we have 6,000 of multidisciplinary teams, that there is the nutrition and the other professionals that can work and share that kind of knowledge for family health teams. So I believe that that we have enough professional, but I think that the main goal in Brazil is to spread that kind of knowledge and become that practice like that provide, for example, knowledge like this material that I show. Can I just show the material that? Yeah. That kind of material, it's important to family health teams use on daily basis. So I think that it is our main goal in order to become more easy and people and the health professionals day by day using and help to advance it against the obesity in children. I think that's the main goal.
Very nice. Thank you so much. I think I will close the session by just answering and wrap up the session, which I thank so much our dear panelists, our esteemed colleagues. I think we covered a lot in this session. We all shared our experience. This is actually a very nice cross-country collaboration by itself. I just chose this one, and I think this will be a little bit out of the box in terms of interventions. We have talked about cross-country collaboration. We have talked about multi-sectorial approach. We have talked about so many initiatives. But I think now we are in a new era. And when I say that we are in a new era, we have to understand what was the best buys from the last 20 years and how we want to move forward. Are we going to intervene the same way? Are we going to do the same sort of approach? And I think that most of the times we don't include the individuals. We don't do it on a bottom-up participatory way. And I think we need to co-create solutions on that matter. The interventions are usually designed, but this is a global era where individuals get their informations every day by the minute. So in terms of scientists, in terms of political action, in terms of academia, we need to think this just accumulate in a different approach. We actually used to say, think global, act locally. I think we should reverse it. I think we should think locally, understand the problems that the community have, the individuals face, and then maybe go bottom up and act globally. Okay? Thank you so much for this session. This was very, very, very insightful, inspiring. Thank you so much. Thank you.